My name is Stephanie Kimmis. I'm a nurse practitioner here at Help Care Clinic. I want to talk to you today about a condition called seasonal depression. You may have heard the terms seasonal affective disorder or SAD or even winter depression. Well, as the term suggests, it is a seasonal depression. That is, it occurs in typical season changes, such as what is occurring now in our neck of the woods from fall to winter, where the temperatures drop, the skies get cloudy, and there's not as much light to be seen. Some people actually have this condition from the spring to the summer. But what we're going to talk about today is mostly what has to do with winter depression, which is what is occurring right now. And some of you may be feeling the symptoms of it. Well, what it is, or what it feels like, people describe to me, is feeling out of sorts, feeling not themselves, feeling lethargic, sluggish, and oversleeping, which, I can understand sometimes with how the weather is here in other northern climates. But that oversleeping leads to daytime fatigue. Actually, it's not restorative sleep. There's daytime fatigue, there's irritability can be involved, and just not feeling well. It is a real condition. And classically speaking, people oversleep and tend to hibernate, but also overeat. There's that craving of particularly carbohydrates. And with the oversleeping, the overeating, with those carbs comes the unwanted weight gain that does not make you feel very well either. And that is to the tune of about 6 to 9 pounds on average. Well, who gets this disorder or condition? It can occur in women and men equally, although I think women tend to seek care for this more than men do. It tends to start around the time of young adulthood, 18 to 30s or so. It can occur for some people every single season, and you see that pattern. And for the diagnosis, you need to have that pattern of a couple of years. Some people don't get it every single year, but some do struggle every season, and that gets tough. And of course, where we live here in Minnesota and in other northern states like the Midwest, but also Alaska and New England, people who are at risk are also those who have major depressive disorder or bipolar disorder. Or you may have people in your family, relatives that have depression or bipolar disorder. And it can be more common in those families, have difficulties more than others. So the further away we are from the equator and more winter type season we're more at risk. So it's estimated about 0.5% or 3% have this disorder, although it's probably underreported. So what causes this condition? Well, there is some research that suggests certainly that the lack of sunlight or as much sunlight when our days get shorter in the winter season contributes to serotonin dysregulation. And serotonin, as you may be well aware, is a neurotransmitter in our bodies, and that gets disrupted. It can lead to low mood. And then other research suggests that there is an overproduction of melatonin from that darkness, and our body's circadian rhythm gets disrupted. That is the sleep and awake cycles. Other research is ongoing, and we will be looking to that for further information as well. But I will tell you, there is hope and there is treatment. One of the things that I have on right now is a light box. You may have heard it referred to as a happy light, but what I have here in my office today is giving me a nice 10,000 lux bright light that mimics the outdoor exposure that we need without the harmful UV light. And this, if you have it right in front of you, 12 to 24 inches from your face with your eyes open, that'll give you a boost. And if you do that 30 to 45 minutes every morning, even prior to the winter season or the season that affects you, about a month in advance, you can even prevent some of these symptoms from occurring. So if you do this 30 to 45 minutes on a daily basis throughout the season, it has been shown it can be up to par with medication. And so it's something you could try. I do want to advise you that you might want to check with your physician or your nurse practitioner or other provider if this is something that is okay for you to do. If you have an eye condition, check with your eye doctor as well. Another thing that can be helpful is vitamin D. Vitamin is very helpful for a lot of things. But I would refer you to my colleague Dr. Strobel's learning module about vitamin D and how that works, as it's drawn from the sunlight, which we don't have as much of in the winter season, and it converts it to a hormone in our bodies to produce that vitamin D that we need. Also, other treatments can include cognitive behavioral therapy to work through those negative thoughts about winter and about your symptoms can be helpful as well. And for some, antidepressants can be very useful at bringing up that serotonin level. And it's not shameful to need or benefit from antidepressants, because something like this can be very harmful or disruptive of your daily life, and it can affect your work and your family and social life. The lowest effective dose may be something that you could benefit from. So I encourage you to talk to your provider if you'd like more information about that. Treatment can be alone or in combination of these things. And oftentimes a combination is really super helpful for you. Other things like getting outside and going for a walk, engaging with your family and friends, even though you don't feel like it. Talk to someone, let them know how you're feeling. They will help you get the help you need. So please reach out, talk to someone, tell someone how you're feeling. You may be experiencing these symptoms, or someone you know and love. But I encourage you, if you're feeling like you're having dark thoughts, if you're feeling hopeless, it's hard for you to work or to have a social life, or if you're having suicidal thoughts, I really would like you to call, text, or chat 988, which is a number you can call that'll route you to a suicide prevention hotline. And for more information about seasonal depression, I want to give you the resource of NAMI.org, NAMI.org. And I really hope that you will have a wonderful season this year and the coming years. Thank you, and be well.